Hi, I'm Ed Love.
Hi, how are you?
Nice to meet you. Interested in a breast augmentation?
I am.
Good. Do you know much about it or have had some friends that have been through this?
I do.
Good.
A few friends.
Well, I'll give you my 10-minute spiel on it, and if I deviate from something you've heard, read, or your friends might have told you, stop me and I'll explain it to the best of my knowledge.
Okay.
Once you decide to do this, there's 3 accepted incisions to get up underneath the breast to place an implant. 1's the bottom of the breast, 2's around the nipple, 3's the armpit. The nipple and the armpit were designed really to just try to hide the incision more. The gold standard's the bottom of the breast, and it's probably the safest route. Next decision to make is wherever you make that incision, where do you go, above or below the muscle? The gold standard's really below the muscle, and there are 3 good reasons why. 1, you're already tissue short here, so you need as much tissue between the external environment and that implant as possible so your breast will look, act, and feel the most natural. Secondly, later in life, when you get mammograms, that implant underneath the muscle has some benefits by that muscle preventing some of the shadow effects of that implant by not hiding any of the views of your breast tissue from the mammogram. So your surveillance for, quote, breast cancer is much improved. Thirdly, which is probably most important, is a term called capsular contracture. That's just a fancy name for a scar is all it is. Anything we put in the human body, we put a scar around it or try to wall it off. How hard that scar gets is determined really by how much mechanical massage you give a scar. So underneath the muscle, your day-to-day movement of your arms is constantly massaging that implant or that scar, thus keeping that scar very soft and pliable, and in effect keeping your breast mound very soft and pliable. After you decide where to make that incision and where to place the implants, the choices kind of turn around on you a little bit. Types of implants as well as sizes of implants.
Okay.
I kind of break it down for the patients. Types, at the top, you've got saline and silicone. Have you thought about that very much?
I've heard a little bit about both.
The majority of implants still put in across the country are saline. Silicone is available and by all studies it is still extremely safe. There's some pros and cons of each. 1, if you have at least a moderate A cup, you probably couldn't tell the difference on the left to right putting a silicone on one side and a saline on the other. Number 2, silicone's a little more expensive. Number 3, the incision to get a silicone implant in there has to be longer and bigger because silicone's pre-filled and saline's not. The next decision is really implant size. And I tell all patients this, it's a little bit of a leap of faith. You kind of go to the operating room with nothing, you wake up with something.
That sounds good.
But it's a little more scientific than that. There's a lot of pieces of the puzzle that come together, pre-op, intra-op, as well as Kelly, my nurse, being a female. Things have to look good to her too. But the 4 ways to discuss with ladies preoperatively, I mention all 4 because 2 of them I don't use, so if you talk to someone else, read about it, you'll understand the shortcomings I have with it. The other 2, I kind of combine the pros out of it to help you choose. One of them that I don't use is they make these specialty bras. You can put different size implants in, put your shirt on, and see how you project. It sounds good in theory, but that implant sits differently on top of your breast than underneath, so it kind of can undersize you. Number 2, photos. If you have them, I don't mind it. The way to look at photos, though, is what you don't like. The width, the projection, the shape, maybe the balliness of it. Things you don't like, we can avoid. Photos are kind of like haircuts. Women ripping haircuts out of a magazine, taking it to their hairdresser. It just doesn't work that well. Breast surgery is somewhat similar to that. The 2 I really use, one is more of a mental comparison of talking cup size. Cup size is just a kind of a mental agreement that we agree that you have an A cup. As you know, cup size is very inexact. You could probably go to 2 different stores, buy 2 different size bras, so it tells you that it's not an exact science, but it just gives us an agreement to say you're an A, so when we're in the operating room, a C looks to me as what you think a C is to some degree. In the operating room, after we make these pockets, we have sizers. Before we choose the permanent implant, we can put a sizer in there and fill it up to make sure it's getting you where you wanted to go in the sense of cup size and keeping you in proportion and not looking too abnormal. Also in the operating room, Kelly, my nurse, being a female, goes to the operating room with me. It's got to look good to her. She's kind of your advocate in there. So it's that locker room test. So if it looks good to her, it probably will look good to you too.
Good.
Fourthly, which is probably most important to any girl having a breast augmentation, is measurements. There are 3 measurements you can obtain on a woman's chest. 2 determine nipple areolar position, which determines if you need a breast lift or not. And thirdly, the other one's measuring the base diameter, which basically is telling you the width of the breast. So if you look at the breast like a triangle, the base of that triangle is the width. That width is a certain measurement that should fit the width of the implant. So if you're about 12 centimeters, the implant should be 12 centimeters plus or minus a few millimeters. That's basically what keeps you in proportion. Paying attention to that measurement keeps you in proportion to your shoulders, chest, and your hip size. So that being said, you can get the measurement on your chest wall. You can go look at this chart of implant diameters and determine real quickly which 4 or 5 implants should be on your chest wall.
Okay.
The operation itself takes about an hour, hour and a half in the operating room. Recovery room's a good hour, home the same day.
Hi, I'm Kelly. I'm Dr. Love's nurse, and after your initial consultation with him, you will meet with me and I will go over pricing, pre- and post-op directions, and also scheduling of your breast augmentation. Once we are in my office, we will discuss all of the paperwork and the breakdown of surgical fees. This includes the physician fee, the anesthesia fee, and the facility fee. Any other questions will be discussed at this time. If you didn't notice, all of the initial paperwork has been provided for you on this DVD. If you're watching this on a computer, you can click on the Documents section and a printable version of all of our documents are there for you to print and fill out. They're also available online at www.edwardjlovemd.com. Also, during your office visit, you can see some of Dr. Love's work. This includes pre- and post-op pictures of other breast augmentations. This will give you a better idea of what you will look like at 2 weeks post-operatively and also at 2 months post-operatively. Also, I can let you see and feel a saline and a silicone implant. At this time, we can discuss the differences between the 2 implants and find out your preference. If you are ready to schedule your breast augmentation on the day of your clinic visit, we can pick out a preferred date and time that's based on your schedule and our surgery days. If you're not ready to set a date, that's not a problem. Just give us a call later and we will schedule your date when it's convenient for you. If you have any further questions, we'll be glad to answer them at any time. On the day of your procedure, you will go to the surgical pavilion, which is located in the Higginbotham Outpatient Center. This is next to Baptist in West Little Rock. Once you're in the building, you will proceed to the 4th floor where the surgical pavilion is located. You will then sign in at the registration desk in the waiting room. When ready, they will call you to go over your paperwork and have you sign any forms that are necessary. At this point, they will give you an identification band to be placed on your wrist. From here, you will eventually be taken to the preoperative area by a nurse. Dr. Love and myself will come and visit with you and make small markings on your breasts that help us guide the surgical procedure. At this time, if you have any last-minute questions, we will be glad to answer them. From the preoperative area, you will be taken to the operating room for your procedure. Remember, it takes about an hour to an hour and a half to perform the surgery. From the operating room, you will go to Phase 1 recovery room. Once you are awakened appropriately, you will be taken to Phase 2 in the post-operative area. Your family will be invited back for any last-minute questions or concerns. From here, you will be released to go home.
I appreciate you taking time and viewing this video. I hope it has answered many questions you may have about the procedure, and if not, feel free to contact my office with any questions. I look forward to seeing you soon.